Hey guys, hope you are doing well. This video is about the blood supply of the body. I'm going to explain each and every artery of the body in this series, starting from the aorta. And this video will be specific about the blood supply of the head and neck, and especially the external carotid artery. So this is the ascending aorta rising from the heart, and this is the arc of aorta, and this will be the descending aorta. Just to give you an idea where exactly the arc of aorta is located, so it's at the level of T4 vertebra and it's just anterior to the left main bronchus. So the arc of aorta will give two main branches to the both sides, the left side and the right side. This artery here, this is called the left subclavian artery, and it will supply basically the upper limb. This artery, this is called the left common carotid artery, and this will go upward and supply the head and neck. But the only difference here is that the arc of aorta will give rise to the brachiocephalic trunk first, this trunk, and that will give rise to the right common carotid artery and right subclavian artery. So today we'll neglect the other arteries and we'll stick to this artery called the common carotid artery. And at the upper portion of this artery there are certain receptors called the carotid body, and this will sense some certain chemical substances in the blood and help in the homeostasis. At the level of C4, fourth cervical vertebra, or just above the border of the thyroid cartilage, the common carotid artery will bifurcate into the external carotid artery and internal carotid artery. The internal carotid artery basically it will supply the brain and the eye and the pituitary gland, and the external carotid artery, this will supply basically the scalp, the face and the neck. Just at the beginning of the internal carotid artery, there are certain baroreceptors called the carotid sinus, and it will give signals to the brain if there is any change in the blood pressure. Let me first give you a rough idea of the branches of the external carotid artery, and then we will go into the details of each branch. So this is the external carotid artery, and this is the first branch called the superior thyroid artery, and it will supply the thyroid gland. This is the second branch called the lingual artery, and it will supply here the tongue. This is the third branch called the superior pharyngeal artery, and it will supply the pharynx. This is the fourth branch called the posterior auricular artery, and it will supply the ear, as the name indicates. The fifth branch called the occipital artery, and it will supply the occipital area. This is the sixth branch, and this is called the superior temporal branch along the temporal bone, supplying the same area. This is the seventh branch, the facial artery, and it will supply the face. And this is the last branch, the maxillary branch, and it will supply mostly the teeth and the anterior and the deep structures. The external carotid artery will move upward and will give two terminal branches, the maxillary artery and the superior temporal artery. So these are the terminal branches, and on its way it will also give rise to 6 more arteries. I have a mnemonic for this: some anatomists like freaking out poor medical students. So there are 8 main branches of the external carotid artery, and I'll explain each of them one by one. Okay, coming to the first branch called the superior thyroid artery. As the name indicates, it will supply the thyroid gland by the first branch, and it will give another branch that will supply the muscles of the neck, the thyroid, the sternohyoid, the omohyoid and the sternothyroid, these muscles. And it will give another branch called the superior laryngeal artery that will supply the muscle of the larynx. Coming to the second branch, the ascending pharyngeal artery, it will move to the posterior part of the cranial cavity like this through the jugular foramen, and it will supply the pharynx, pharyngeal constrictor muscles and the posterior part of meninges, because it will continue here as posterior meningeal artery. And it will also give another branch called the inferior tympanic artery. The third artery is the lingual artery, this one, and this will move here and this will pierce the muscles of tongue. For example, this is the tongue, so this will pierce the muscles of the tongue and continue as deep lingual artery. Okay, so obviously it will supply the tongue, and it will also give branches. The first one is the dorsal lingual artery. This is the dorsal lingual artery. It will supply the mucous layer of the dorsal part of the tongue. And the other one is the sublingual artery. This is the sublingual artery, and it will supply the sublingual gland. So the lingual artery will also give rise to 3 branches, like it will continue as deep lingual artery, it will give dorsal lingual artery, and it will give sublingual artery. The 4th branch is the facial artery, this one, and this is one of the major arteries. It will arise at the mandibular angle, and it will move downward and curve around the base of the mandible, and it will move upward to the medial of the eye here. This artery has so many branches, and it is divided into 2 groups. Some arteries which arise at the cervical region, and some arteries which arise at the facial regions. So those which arise at the cervical region, the mnemonic for them is TAGS, T-A-G-S, TAGS. The first T stands for the tonsillar artery, and it will supply the tonsils. A stands for ascending palatine artery, and it will supply the soft palate. G stands for glandular artery, and it will supply the submandibular gland. And S stands for submental artery, and it will supply the submental and the submandibular gland and the floor of the mouth. The other group which arise in the facial region, the mnemonic for them is all. A for angular artery, and it's actually the terminal branch of the facial artery. When it moves upward, it continues as here as angular artery. This is called angular artery. L for labial artery, the superior labial artery, this one, and the inferior labial artery, this one, and this will supply the upper and the lower lips. And the last L is for the lateral nasal, this one, the lateral nasal, and it will supply the dorsum of the nose. One thing important here is that the facial artery or the angular artery, the terminal branch, it will anastomose with the dorsal nasal artery, this one, which is the branch of ophthalmic artery. And simply we can say that the external carotid artery and the internal carotid artery is to anastomose here, because this is the branch of internal carotid artery, and angular artery is the branch of external carotid artery. The next branch is the occipital branch, this one. This will move to the back of the skull, move upward and backward, and supply the occipital region. It has a branch called the mastoid branch here at the mastoid foramen, that will supply the meninges here, this one. And it will also have another branch called the sternocleidomastoid branch here, this one, and this will supply the same muscle. It also has some branches for the external ear, and descending branches for the neck muscles like trapezius. The next artery is the posterior auricular artery, this one. So this will actually supply the external ear. This is like the ear region. It will supply the external ear and the scalp around the ear. It will also give another branch called the stylomastoid artery, this one, or stylomastoid branch in the stylomastoid foramen, and it will supply the middle and internal part of internal ear, mostly the middle ear. Coming to the maxillary artery, this one is a little confusing, so I'll go into a little details. It has 3 parts. The first one, this is the artery behind the temporomandibular joint. Then the second part here in the infratemporal fossa, and the third in the pterygopalatine fossa here. So this artery will be going like this. Okay, so this is the first part, which is we cannot see, behind the temporomandibular joint. This is the second part in this fossa, and this is the third part behind this in the pterygopalatine fossa. Maybe you can visualize right now. So the first branch or the first part of maxillary artery is the deep auricular artery here, this one. This is the deep auricular artery, and it will enter the bony wall of external acoustic meatus. It will supply the skin of the external acoustic meatus, the part of tympanic membrane with which we are able to hear, and the temporomandibular joint, because it is along this path. So it will also supply the temporomandibular joint. The second artery from this part is the anterior tympanic artery and will simply supply the middle ear. Then the third branch and very important branch, this is the middle meningeal artery. This is the middle meningeal artery and will enter into the middle cranial fossa through the foramen spinosum and will supply the major part of the meninges. It also give a branch called the superior tympanic branch for the middle ear. Here it will give a branch for the middle ear. And this middle meningeal artery is very important because in the pterion, there is a part in the skull called the pterion. There is very probable trauma to this artery, and most of the subdural hematoma are due to the rupture of this middle meningeal artery. So it is clinically very important. The last branch is the inferior alveolar artery. This one, it will move along the mandible canal like this and move through these foramen called submental foramen. It has branches, the dental and paradental branches, and will supply the teeth and gums and also the floor of the mouth. It has branches called dental and paradental. So the first one is the mesenteric artery. This one, it will supply the mesenteric muscle. The second one is the anterior and posterior deep temporal arteries. Okay, and there will be two, like on the anterior and the posterior side. The deep posterior temporal artery, and this will supply the same muscle. Then the pterygoid branch, this one, and will supply this muscle, the pterygoid muscle, and at the end there will be a branch called the buccal branch or buccal artery. It will supply the buccal muscle, and it is the same muscle which helps in smiling and pushing the food when we are swallowing. The first artery from the third part is the superior posterior alveolar artery, this one, and this will run along the maxillary tuberosity, enter into the alveolar canal, and it will supply the molar and the premolar and the gums and the maxillary sinus. The second branch here is the infraorbital artery. This is actually the continuation, and this will enter into the optic cavity through the optic fissure here, and then it will sneak out to the anterior part through the intraorbital fissure and will supply the anterior of the face, and has also a branch called superior anterior alveolar artery that will supply the maxillary sinus, the canine and the incisor teeth, and the gums. The third branch here is the descending palatine artery here, this one, and this will divide into the greater and lesser palatine arteries, and as the name indicates, it will supply the hard and soft palate, and it will continue here. It will continue and enter the nasal cavity upward here through the incisive canal, and will anastomose here with the sphenopalatine artery. The next artery is the sphenopalatine artery, this one, and this will pass through the sphenopalatine foramen here, and this will anastomose here with this greater palatine artery. Here these two arteries and the anterior and posterior ethmoidal artery and superior labial artery, these all arteries will anastomose, and this area is called the Little's area or the Kesselbeck's area, where all these arteries anastomoses, and mostly the nosebleed is due to the rupture of these vessels in this area in the nasal septum. The last artery from this part is the artery of the pterygoid canal, and as the name indicates, it will be present in the pterygoid canal, and it will supply auditory tubes and little of the tympanic cavity. Coming to the last artery, the superior temporal artery, actually this one, and it has two terminal branches, the frontal and the parietal branch, but it also have three more branches, so a total of 5 branches. So coming to the first one, the frontal artery, this one moves upward and forward like this, and it will supply the muscle, the skin and the bones in this area. The frontal artery will anastomose here with the superior orbital artery, which is a branch of ophthalmic artery, so a sub branch of internal carotid artery. So we can say that here is the anastomosis of the internal carotid artery and the external carotid artery. The next branch is the parietal branch or the parietal artery, and this will move posteriorly and downward, and here it will anastomose with two arteries, the occipital artery, this one, and the posterior auricular artery. And it will supply, it is a superficial artery, and it will supply this region, the scalp actually. The remaining three branches are the minor branches. The first one is the anterior auricular arteries. Here, this will arise here, and this will supply the auricles and the external acoustic meatus. The second artery is the transverse facial artery, this one, because it moves transversely, and it will supply the parotid gland here, the masseter muscle here, and the skin of this side of the face. And the third branch is the middle temporal artery, and this will supply the temporal muscles. One important thing here is to remember the blood supply of the teeth. Okay, so we can divide the supply of the teeth into two: the superior side and the inferior side. The superior side of the teeth, these are supplied by the superior alveolar artery, which is a direct branch of the third part of the maxillary artery, and the other one is the inferior alveolar artery, which is the branch of the infraorbital artery of the third part of the maxillary artery. And the inferior side of the teeth, these are supplied by the inferior alveolar artery, which is the direct branch of the first part of maxillary artery.